Hi, Dr. Sushma. Welcome to this interview by Media Hanger. Today, we're going to be talking about increasing levels of sedentariness and obesity, especially during the COVID-19 pandemic and in children. So before we get started, would you like to tell us a little bit about your work, yourself, what you do at Rainbow?
Thank you so much for having me today for this discussion. I'm Dr. Sushma Kalyan Achuta. I'm a consultant pediatrician and neonatologist working at Rainbow Children's Hospital, Hebbal. I have almost 10 years of experience in pediatric field and catering to children with common problems to severe illnesses, including neonates, pediatric, as well as adolescent age group. So it includes a comprehensive care for pediatric patients. And of late, it has been challenging as the world is facing, health crisis in form of a pandemic and a lot of various issues rising with it. In children's also, we are seeing many illnesses and varieties of presentations. So it has been a challenge for us also, including, everybody else who's facing this. So I would be delighted to share my experience and inputs regarding the topic of discussion today.
All right, thank you. Thank you for that enlightening, detailed introduction. So to begin with, I think we can talk a little bit about measures of health and wellness. So I've read often, and it's not just recent, obviously it's been there for the past few decades, the body mass index. Although the BMI is often used for both children and adults, I feel like a lot of people, including myself, are very skeptical of it because it ignores a lot of, I guess, crucial factors regarding body fat percentage and bone density and things like that. So could you tell us a little bit about why the BMI is so widely used and, especially for children, why it's so widely used, and whether it has any merit at all as a measure of health and well-being?
Yeah. So like you rightly put in, the body mass index or BMI is one of the variables which is used to assess a physical health status of children or adults. There are various such measurements which can be done to assess. Now, BMI is an indirect measure which gives us an estimate of the body fat, which helps us to classify the standards of health for children or adults. There are various other measurements. Physical measurements, if you look into it, it could be things like skin fold thickness, the waist circumference, the waist to hip circumference. These are some of the measurements that we could do, which can be easily done in a clinic-based or OPD-based setup, which can be used to screen children and categorize them in terms of their standards of health. There are other various tools or equipments which can be used to analyze the physical status per se, like you said, to assess the body composition, which includes assessing body fat percentage, assessing the lean muscle mass or the bone density. So when we're assessing with BMI, it gives us an indirect interpretation of the body fat percentage. Though it is an indirect measure, but it kind of correlates with the body fat percentage. So that is the reason we are using it very widely. And another thing is it is a screening tool. So we screen with BMI and categorize the patient based on the values that we get. And in case it is in an abnormal range, then that needs to be further evaluated and do certain other confirmatory tests. Now in adults, the BMI is a formula that is calculated in a very simple way with just using the height or weight of a person. So BMI is, calculating the weight in kilograms upon the square of the height in meters. The formula remains the same, what we use for both adults and children, but the difference is how it is interpreted. In adults, the value obtained from this formula is what is used to classify the weight parameters, calling them underweight, normal weight, overweight, or obese. But when it comes to children, it is interpreted in a different way. It is interpreted as percentiles. That is because children are continuously growing and the growth velocities vary in different phases of age groups as well as gender. And the body composition of children also vary with each age group, whether it's adolescence, pubertal, infancy, also along with gender. Now, the value of any approach is greatly enhanced when we have a good reference data. So when it comes to BMI, we have a lot of reference data from various bodies like WHO and CDC, and we have various growth curves called the percentile curves. So in children, the BMI is interpreted as percentile and not as an absolute value. So it is plotted in these percentile curves, which is age specific as well as gender specific. That is because we have all these data. So we are able to plot them on these curves, and it helps us assess. Now, for example, if a child has a BMI of 65 percentile, that means that this child has a BMI more than has a BMI is 65 percentile, if I say. So this child's weight is 65% more than the children of that particular age and sex. So that is how it is assessed. So that is why it is different. So this is again a screening tool where we classify it as, underweight, normal weight, overweight, and obese based on these percentile values. So that is why it is different in children, and it is widely used because it is very simple calculation, and you plot it in the charts, which gives you an assessment. And what is important to remember is that it is a screening tool. Once we see anything abnormal in these values, the child definitely needs further workup and further assessment to see what is happening.
Right. So to put BMI in a little more present or topical context, I read a recent report, and multiple recent reports actually, which reveal that 53% of children in Bangalore have an unhealthy BMI. And my first intuition is to put the cause of that on the lockdown and the consequent restrictions on children's movement and such. So what do you as a pediatrician make of that information?
Okay, so globally, in the last 3 to 4 decades, the incidence or the prevalence of overweight and obesity has drastically increased. It has almost tripled in the last 4 decades. Initially, it was thought to be a problem or a concern of high-income countries, but it is not so. Of late, we are seeing a lot of low-income countries as well as middle-income countries facing issues of overweight and obesity, both among children and adults. Now, this is because of a lot of changes which has happened as a community, as a society, with a lot of urbanization happening even in low and middle income countries. So there has been an increase in intake of food or beverages which are high in energies, and associated with a significant decrease in the amount of physical activity, which is attributed to various factors which are increasing the sedentary nature of our work culture, or modes of transport, or urbanization in specific. So the problem is already existing, and we are seeing a rising trend of the problem persisting even in countries like India. In India, we are facing, a double burden of malnutrition, which includes both the spectrum of, being, underweight and poorly nourished, to overweight and obese. We are seeing both the spectrum within the same community or society. So it is definitely prevalent in the current times, and these lockdowns and restrictions have definitely just accentuated this, because it has brought down the levels of physical activity, also put some restrictions on nutrition wise. So it has just exaggerated the already existing problem, I would say. And it is becoming a significant problem which we have to, as a society, community, or as a nation, be aware of and take strict action against it.
Yeah, exactly. And I really like what you said also, because particularly, I guess, overall health depends on a lot of factors. And two of the most important being, your genetic makeup, as well as the, I guess, the nature versus nurture, the nurture that you get, your physical activity and whatnot. And speaking of physical activity, one of the primary spaces for physical activity in children is school. And in the absence of in-person education, in the absence of going to school physically, what would you say are some alternative strategies for children to get enough exercise every day?
Yeah. It has been tough. So we daily encounter parents in our day-to-day practice expressing their challenges in handling their kids of all age groups. It could, range from just a newborn infant to a toddler or an adolescent, school-going kid. So they have faced a lot of challenges in terms of health, in trying to make sure overall they are able to provide what the child needs, because you and I would understand the whatever is happening because of the pandemic, but for kids they don't know what exactly is happening, and certain especially the smaller kids who don't understand why they're not allowed to go out, who don't understand why they are not meeting their friends, or they have that they cannot go out and play in the playground. So it is definitely very challenging as caretakers or parents to handle this. But as a family, you all, parents or caretakers would have to sit together, talk to their children, a little adolescent teens, you could sit and have a discussion, talk to them. Also, along with the physical wellness, what is important is emotional and mental wellness, because we don't know what they are, identifying or what their understanding of the situation. So it is very important as a family to bind together, communicate whatever their queries are. Sometimes you'll be surprised, children ask specific questions that why am I not able to do this? So that amount of communication should be there so that they understand. And we have to make sure that they are getting that amount of physical exercise that they need. Otherwise, they would just be sitting around, and which could add on to many other problems that could arise. I could just probably, because this needs to be actually customized to every family and every, the environment in the home. But I could probably just give a few tips which, we could work on, and they could just figure out what they can do as a family to make it a better, physically and mentally, nurturing their children. One is, to set specific goals, where you set a specific goal or time oriented approach where you assign certain time to particular physical activity, which could just be simple like walking, jumping, cycling, doing just dancing to some rhymes or tunes. Just incorporate these, have small accessible targets or goals, and then work on it on an increment basis. So that is something we should do. We should be aware that this is something you have to consciously work on with your kids and set goals. Second thing is, it is very important to get creative with children. You cannot just say that, you do these many number of, jumping jacks, or you do, these stretches. That is not going to work out definitely. You have to get creative. It should not become a task for both the parents and the kids. It should become a part of their play or an activity. That is how you have to, mold it and incorporate in their daily lives. Only then it is going to work out. So you have to get creative in how to get it done. It could be a part of a storytelling session where you also do certain physical things. It could be a part of a play, or you could involve multiple family members for multiple things. Sometimes they don't like this, the same person. When they find variety, today it's the mother who has done it, today, tomorrow the father, then the grandfather, elder sibling, some things. So they need variety, they need change, they need the creativity to keep them engaged. That's the second thing. Thirdly, what I would like to say is, you don't really need a lot of resources, equipments to make sure they're doing their physical activity. You just incorporate what is available in your home environment. Just simple things like I said, dancing to music or just blowing balloons. That is a good exercise for your lungs. And use simple items at home. You don't have to buy a fancy bat and ball, or not, or expensive toys. Just with day-to-day activities, kids actually enjoy playing with these rather than you buying them expensive, gadgets or toys. So incorporate these things. So these things can be done at any home. You really don't have to invest in specific toys or resources. Use what is available and incorporate it. Lastly, and the most important thing is, now to inspire kids and motivate them to do the physical activity, the best way is to use set an example. Choose to be active with the kids. Only then it is accepted by the kids as something that is normal, that needs to be done. So you have to set an example, incorporate physical activity as an health priority, and as a unit we all need to be focusing on it. Only then children will be doing it. But despite all this, I understand it's very challenging. So we'll have to see what works out in your family, your environment, and your kind of setup, and see what works for you.
Yeah. I never thought of blowing balloons that way. That's really interesting. And yeah,
It is. It
it makes
is.
sense. Yeah, it does. It does.
Oh, yeah,
And I want to pick up on the thread of what you said about creativity, especially, in
yeah,
the context of mental health and physical health.
yeah,
And we
yeah.
know from repeated research, and I know especially from personal experience, that physical health
Mm,
can have a big impact on mental health and vice versa, of course. So,
yes, yes.
uh, thinking of those two things, I'd like to talk about nutrition, because nutrition obviously contributes to physical health, and then I guess that can impact mental health also. And
Yes.
I would even argue that nutrition is a little more important than physical exercise, because you can exercise for maybe 2 3 hours a day, but nutrition is constant for the rest of it.
Mm, mm.
And keeping that in mind, what can you tell us about nutritional choices? Um, Especially considering that now during the pandemic, the food choices that children have might be limited, and also they expect creativity and they tend to get bored with repetitive meals quite quickly.
Yes, yes, yes. So nutrition is definitely one of the main things when we talk about health, overall health of a child. So depending on the age group of the child, we have to make sure we are giving them the adequate nutrition that they need for their normal growth and development. So based on the age group, you have to make sure we are giving that target specific amount of nutrition. For small kids, newborn babies to 6 months old, it is all breastfeeding. So so it is very important for a mother and the family to make sure that babies are exclusively breastfed up to 6 months of age. That would be the best nutrition that we would be able to give to children of that age group. Breastfeeding needs to be continued until 2 years of age. That has been recommended by WHO. Now, during this breastfeeding, what is important is that the mother makes sure that her nutritional intake is on board, because that is how the baby is going to be nourished. So it is not only the children, the mothers who are breastfeeding their infants or small ones have to ensure they're taking adequate food and nutritious food. For a little elder group of kids who are taking solid foods, another important thing is very timely initiation of complementary feeding or weaning foods that we say. So which needs to be started at completion of 6 months, uh, and the slower transition from these solid foods to complete uh, consumption of family pot diet by around 1 year of age. That transition also is very important. Elder kids, we have to make sure they're taking everything that the family consumes as a family pot diet. There is no need for children to have a special diet, special food preparation as such. So they should be consuming what is being prepared as a family pot. So as a family, we should be taking nutritious diet. Just a few points that I could probably say to make sure that that nutrition is happening is one, make sure they're getting balanced diet. So their food should have things like fruits, a portion of fruits, a portion of vegetables, legumes, pulses, cereals, dry fruits, and a lot of things which are commonly used as a part of the family diet. The same thing needs to be given, but we need to make it, a variety of foods, and also offer them in the way that they enjoy. They may not enjoy, fruits the way you and I would eat it. They might like it chopped. Sometimes they like it in the form of a smoothie or a juice. So we offer it in varieties of forms and varieties of colors, and adding on multiple things into one single recipe and making it. That is something we'll have to work on so that it is more acceptable by them. Also, what is important is incorporate them into the family meal time. So rather than having a separate meal time where the caretakers are trying to feed their kids and they are running around all over the house, they are behind their kids to feed them, it becomes a task both for the caretakers as well as the kid. Rather than that, kids need to be involved in the family meal time all along with the kids. Even small kids would enjoy sitting beside you when you are having your plate of meal, trying to explore what it is, touch and smell and feed by themselves. It is going to be messy, but that is how they're going to explore and learn about food. So it is absolutely important to make that happening rather than, running behind them and forcing them to eat. So that is something we make sure we're giving them a balanced things of food. Another important thing is make sure they're hydrated well. So they need to get their amounts of fluid intake in a day, which could be in the form of water or juices, fruits, vegetables in any form. That is another thing. Another thing, what is important that I want to stress during this time is give your kids fresh food, homely, homemade, home cooked foods, which would ensure that the nutrition value remains, and avoid processed foods, canned foods, tinned foods, junk foods, which could be an easy alternative. It is actually very difficult to find options to give healthy snacks to your kids. Meal times are usually taken care of, but it is when they're at home and they constantly are asking for these small snacks in between that you will be really wondering what to give them as healthy options. So you need to incorporate fruits or yogurt or small or just a smoothie or something like that, a healthy snacks in between rather than opting for processed foods, which will have some amount of preservatives, chemicals in them, which could in a long term harm the kids. So use fresh foods, home cooked foods, make sure you're giving balanced diet. Another important thing is avoid a lot of sugary or salty foods and beverages, which includes things like canned sodas or juices, any of these things that should be avoided because they do not have much nutrition value at all. They would just reduce the appetite for other healthy diet. So that is something we should make sure we are able to do, and use the items which are easily available. Try to find a variety, incorporate multiple things so that we are covering all the aspects of nutrition like carbohydrates, proteins, certain vitamins, minerals. So if you're incorporating fruits, vegetables, pulses, dals, everything that you usually do at home, you would be able to achieve a balanced diet. Certain children who have specific special nutritional demands, that you need to discuss with your healthcare provider and make a specific plan for that. But overall, it should be achievable with whatever you are able to do at home, I think.
Right, thanks for that. Let's slightly shift the line of question right now, and I'd like to talk about something else that has been that I've been thinking about, which is increased screen time. Obviously, during the pandemic, everybody's had increased screen time, right from school kids till the working population.
Small kids.
Yeah, exactly. And to put that specifically in the context of the former, which is children who need at least 8 to 9 hours of sleep every night, they probably don't get that right now because of the increased screen time also. And we know from years of research that increased exposure to blue light can affect the quality and time of sleep. So do you think that could also be a factor in the higher levels of obesity, which we're talking about in children? And if it is, then how?
Yeah. So there has been a lot of increase in screen times in in the new generation of kids overall, and this lockdown has just increased it because it is very difficult for parents, especially if they're working, to make sure the kids are involved in something healthy. So they end up using a lot of screen time. There have been a lot of evidence which suggests that increase in exposure to screen time increases the prevalence or the incidence of overweight and obesity. This could happen by usually three mechanisms. First thing is when they're constantly using screens, which could be phones, tablets, or some games or something. So this exposure is also associated with them having continuously eating something while they're watching the screen, some snacks in between, or continuously munching on something. That is one factor. Second factor is during their screen time, they are exposed to various advertisements of a lot of not so nutritious foods and beverages, which is actually not in your and my control. It just pops up on the screen. You and I will also be seeing so many such advertisements. These, especially even in children apps or children portals, if you see, they keep popping up. So these also are very tempting to the children and they ask you for it. So it is very important for parents to supervise the screen time and make sure that these things are not affecting them. And they realize that the importance of that, how, and be aware, that whether it's good or bad, that they need to be told about. That is something. The third thing is definitely, so a lot of screen time is affecting their sleep pattern. It is causing a lot of stress. We are seeing a lot of kids coming with symptoms of headache, reddish eyes, a lot of strain over their eyes, back pain because of the posture they have to maintain to, while they are exposed to the screen time. So we are seeing all these issues, and it is definitely affecting their sleep pattern time. So it is very important that we make sure that we are tackling all these issues. So it is very important to limit the screen time, have a daily limit or a weekly limit of the screen time, which includes their academic work as well. It is important to strictly follow that, because we do see a lot of consequences of prolonged screen time. Children less than 2 years of age are recommended to have zero screen time, which is 100 times not, no, 100% of the time not happening. We see infants as old as 6 months, 7 months, looking into the phones of their parents for rhymes or games or something. So it is really disturbing. Even elder kids, right now, it is a part of their online schooling. So there is definitely some amount of screen time, but we should be able to limit that screen time, and make daily limits. You have to set daily limits or weekly limits, and plan with your kid. Secondly, about the supervision, I told you that definitely needs to be supervised. Thirdly, about the sleep pattern, what we can do to help them have a better sleep pattern is to avoid any screens in the kids' bedroom per se. So the screen time, whatever happens, or academic things, whatever happens, should happen in the living room, supervised with adults. During bedtime, there should be no screen time for 2 hours before they go to sleep. That would ensure that it affects less of their sleep. There would be less disturbed sleep or arousals from sleep happening. Secondly, like I said, no screens in the bedroom at all. Those are the few things that we can work on to prevent these adverse effects. And during screen time, there should not be any munching on the snacks. The meal schedule should follow as it is. So those are the things I think we should focus on, and to prevent the adverse effect of these screen times, definitely.
So a certain condition that has been associated with sleep is called sleep apnea. Now, I'm not very familiar with what it is, but I've read that obesity can lead to increased instances of sleep apnea. So could you tell us a little bit about what sleep apnea is and whether obesity can in fact lead to it?
Yeah. So being overweight or obese adds on to sleep disturbance conditions. One of them is sleep apnea or an obstructive sleep apnea that we cause. So being overweight or obese causes a lot of sleep disturbing issues. One of them is something like a simple primary snoring. So you see a lot of kids coming with a lot of loud snoring during sleep time. That is because of an obstructed breathing during the sleep time. But this is not associated with apnea. That means stopping of breathing for some time. So this would be not very serious. So it could be one of the milder forms of sleep disturbance. The second thing is whether is upper airway resistance syndrome, which causes them to have an increased respiratory effort during sleep. Now this could happen because of obstruction in the airway, because of the fat deposition in the neck, or overall narrowed airway, which causes this. Now, the extreme picture of this would be what we call an obstructive sleep apnea, where there is significant amount of obstruction of the airway because of fat deposition around the airway, as well as a subcutaneous fat deposition in the neck and the chin muscles. So it narrows down the circumference of the airway, which makes it difficult for the child to breathe, put in a lot of efforts, and it causes a brief stoppage of breathing, which we call apnea. Now this in turn will cause drop in oxygen levels in the body, and it can lead to other severe, if it stays prolonged, it could cause to a lot of disturbance in terms of causing low oxygen levels, going into a stage of even having altered mental sensorium and all those things. So that is another extreme thing. So with being overweight and obese definitely puts you at a risk of obstructive sleep apnea. What is important is to be aware about it and be able to identify it and report it to your healthcare provider. If we are able to identify it earlier, we could prevent the consequences which could happen because of this. There are various methods to tackle these problems. Usually, kids have enlarged lymphoid tissues in the oral cavity, which is the tonsils and the adenoids. So even normal weight kids can have this sleep apnea. So in these kids, usually just removal of these enlarged lymphoid tissues would solve the problem. But in overweight or obese kids, because there's also associated fat tissue accumulating overall, this just aggravates the issue. So sometimes along with this, a lot of other, multidisciplinary approach has to be taken where an ENT person would analyze, nutrition would have to be taken care of to, bring down the child's growth parameters into a normal range. A lot of hormonal assessment has to happen. Sometimes they may need surgical correction, which would help them, get over this obstruction. That could be an extreme thing. What is important is for parents to be aware that this can happen both in normal as well as the overweight or obese, but this problem would cause more consequences in overweight or obese children. Identify it, report to your healthcare providers at the earliest so that we can prevent the complications and it could be treated.
Right. So similarly, right now schools are closed, and I'm guessing even though schools are closed, obviously you've said that increased screen time might lead to sleep problems and things like that. And I've also heard of a lot of my friends, a lot of my younger cousins, especially not getting enough sleep. And the fact remains that even when schools reopen, children might not be getting enough sleep, or schools might start too early, or things like that. So I want to talk a little bit about uh, the program or the regime in schools. So two things. Do you think schools are starting at appropriate times? And secondly, about the physical exercise practices in schools. Do you think they're sufficient? Do you think they're healthy? And looking forward to when schools do reopen, would you change anything about the way schools physical education system functions?
Yeah. So schools definitely form a major part of children's health and overall well-being because they do spend as much time in school as they do at home. Smaller kids probably spend lesser time, uh, but it needs to be scheduled into a child's curriculum. Physical exercise or physical education definitely needs to be a particular and focused attempt made by school where it is given importance also along with academic or percentage excellence. The problem is we do not yet have a standard national guidelines or policies which recommends these educational institutes to follow a particular curriculum. So everyone has their own curriculum which suits their own academic and school environment, which may or may not match your child's requirement, timing. So it is very variable right now. Every school has their own curriculum. Small kids need to wake up very early in the morning, get ready, and go to sleep. They're half the time very drowsy in the school, and they just have 2 to 3 hours in the school and come back. So it kind of alters. So it is very important, and also as a society, for us to have a national guideline or a policy which is, uniformly followed all across the schools, where the focus is on physical activity and physical education of the kids, because right now there is no compulsory that physical education needs to be a part of school education, but it is one of the most important thing. Even so, more than at home, school is where more of physical education happens. So that is something that needs to be addressed. Currently what is happening is definitely not the best that we can offer to the kids at school. So we have to work on as a community and society to make sure there is something uniformly that is happening, which suits to particular age group of children. One particular curriculum will not suit every age group of child. So pre-nursery kid or a nursery kid or an adolescent kid would have different requirements of physical activity, education, or things. So it needs to be incorporated. A lot of the times, the hindrances is there is no specific time allotted for physical education. Secondly, you don't have enough trained staffs to specifically teach you physical education in school, which includes physical activities, sports, and a lot of other things. Thirdly, they don't have the resources or equipment to make sure they're giving the targeted education. Many of the schools which are coming up right now do not have even the minimum allowed playground facility for school for kids to even play around, right? They may have some indoor facilities, but it is also important to have a policy which allows schools to have a minimum amount of play area for the kids to play in an open environment. In case the school is failing to meet that criteria, the community play group playgrounds could be utilized for that. That needs to be worked out along with the government and the policymakers. So these are certain things that we have to ensure that they get the right kind of physical education, right amount of physical education in school per se. Right now, I don't think we're doing a great job with it. We should be really working on, having a specific curriculum for them.
Yeah, as you said, the problem often lies in not having enough knowledge,
Yeah,
both in the parts of school, sorry, both
yes,
in school and at home. So, what do you
yeah.
think parents or caregivers at home who don't have sufficient knowledge about this? What are some good sources of information to learn about these things, and how can they help their children better?
Yeah. So what is important is for parents or caregivers to be aware that how to assess your child's overall growth and development. It is not only, when a child gets sick that the child needs attention. Even for a normal growth and development, the child is continuously needs that supervision and guidance by, caregivers as well as healthcare professionals to make sure that they have that right growth and development. So the parents or caregivers should take the opportunity of every visit that they have with healthcare professionals, because we see well kids coming in for vaccination visits. It's not particularly when there is an illness. So those point of contact with your healthcare provider should be utilized to discuss with your doctor about physical health, mental health, emotional health, and what as a parent you're concerned about your child. All these things should be discussed with your healthcare provider. Only then they would be able to guide you better, because most of the time these discussions do not happen. It's usually that they come, that child had a fever or something, or it's just a vaccination visit. We most of the time proactively, assess the child's, growth parameters, plot them on the charts, and tell the parent that see look, your child is a little overweight. So those discussions are not happening both at family level as well as when they come and interact with us. So that awareness is definitely lacking. That awareness needs to come as a society, that it is the goal is not just your baby having a good weight or something. The goal is to be healthy, which includes a lot of parameters. Again, like I said, mental wellness is not at all discussed at all many of the times. Um, Sometimes we notice certain signs in children's just walking in for well visits to the OPDs and then sit and discuss with the parents. That is when they realize that some things are not in track. These are some signs which are alarming. So lack of awareness is very much there. There are accessible people, or accessibility is definitely there, because they do visit doctors for many things. So the problem lies in, is sitting and talking it about them. So many parents even don't like when we say your child is overweight, please work on the diet and, physical activity, because it's general norm in society that, if you have a chubby child, it's a healthy child. They need to understand that that is not true, you know so it is all in awareness, I think. Otherwise, there are various means of getting the information. Your healthcare professional is the best person that could guide you, or you have a family physician, or within your family you have people. You need to sit and communicate and discuss all these things as well as a family, as well as with your care providers. Also, platforms like this, where we discuss about certain specific issues, would be a point of access to parents, I think. So I don't think accessibility is the issue. I think the issue is with awareness and parents trying to, it is very important for them to be aware, where does your child lie in terms of overall growth. I think that is something I would like to emphasize.
Yeah, thanks for that. I think that particularly sort of allays a lot of fears that a lot of people have. And also, I think the whole conversation has been great. So I just want to end on that note. I'll be signing off there, but I'd like to open up the space for you finally to say what you think. Any closing remarks, any advice you might have, any thoughts that you have as a pediatric expert, as a person. What would you like to say to any children or any particular concerned parents watching this video?
Okay. As a pediatrician, as well as a mother of 2 toddlers, I am very well aware of the challenges that parents and caretakers are facing already with children, and more so with this lockdown and the various restrictions. But it is, like I said, very important for them to be aware of the situation, accept the situation. We all are facing a lot of challenges in terms of work, in terms of finances, in terms of health of our family members and dear ones, and definitely children are a part of it. It is very important for us to work on it together as a family, as a society, to make sure that we have a positive environment at home, and we encourage good habits, encourage healthy habits, which definitely play a major role in the long run for overall wellness of a child. So be aware of your child's, health status, by which I mean everything: physical, mental, emotional, educational, everything. Be open-ended and communicate with your children, elder kids, teenagers, adolescents. It's very difficult for them to, at that age group, sit and have a chat with your, parents. They may not be so open to discuss. But this time that we have got to spend with families together, during the lockdown, should be utilized to strengthen that bond and get those discussions going, and focus and talk about what, we could do in terms of nutrition, in terms of physical activity, in terms of getting that physical assessment done by your doctors. What can wait, what should not wait, what would need an emergency interference, what needs to be changed as a family per se. There are many things that, as a family will have to change so that we make sure the kid is, able to follow it. So it is a cumulative effect. We all have to work together for all of us to, have an overall health and well-being, I think. And I definitely appreciate all those parents and caretakers who are really, working hard to make sure, keeping their families and homes together. But it is important to be aware and focus on, overall health.